It's estimated more than 3 million Americans have schizophrenia, and it can have a devastating effect on the lives of the people it touches. We spoke with Dr. Geetha Paladugu at Redlands Community Hospital, asking her to discuss schizophrenia.
Schizophrenia is a complex mental disorder that is characterized by a breakdown in thought processes and a decrease in emotional responsiveness. A person that is diagnosed with schizophrenia generally experiences hallucinations, most often reported as hearing voices, experiences delusions which are mostly bizarre or persecutory in nature. There may also be disorganized speech and thinking, social isolation, sloppiness of dress and hygiene, a lack of motivation, and impaired judgment are also commonly observed. Schizophrenia is distributed equally in males and females. The ratio is 1:1. In males, it seems to start early in life, anywhere from 15 to 25 years of age. And in females, there seems to be a slightly later onset at 25 to 35. And with every episode, there is a decline in functioning, with the person not being able to return back to their previous level of functioning.
Dr. Paladugu talks about the risk of getting this illness.
The single biggest risk factor for schizophrenia seems to be in having a first-degree relative with this condition. Monozygotic twins are affected 40% of the times. Other environmental factors need to be considered, like living in urban areas or the use of drugs seems to be associated with the development of schizophrenia. Other early life factors that have been implicated are hypoxia, malnutrition, or infection in the mother during fetal development, birth complications, winter or early spring birth seem to be having a slight increase in the development of schizophrenia.
How is schizophrenia treated?
Medications are the mainstay for treatment. Psychosocial interventions do seem to augment the clinical outcome. Antipsychotic medications have revolutionized the treatment of schizophrenia. These medications are extremely effective but are associated with both annoying and sometimes serious side effects. Hospitalization will need to be considered when patient safety is an issue because of suicidal ideations, homicidal ideations, or because the patient is gravely disabled and is unable to care for themselves. 40 to 50% of times the patients respond very well to medications. There is a moderate response about 30 to 40% of the times. And in about 20% of the patients, there is what is called treatment resistance. The data also shows us that 80% of the patients will relapse within a year if their medications are discontinued, whereas only 20% of them will relapse when continued on medications. Compliance is very important in treating this condition, which has significant economic and human costs.